I'll be talking about health literacy, specifically regarding non-English speaking patients in the healthcare field. I'm not sure if you know this, but 21% of Americans do not speak English. That is according to the 2011 census. And due to this statistic, I do believe that we should have medical interpreters, medical information, and handouts readily available for patients, not only who are non-English speaking but may not be fluent in English. So medical interpreters do offer language assistance for patients who are non-English speaking. This will help them understand what is happening during their appointment or hospital stay. It will help them understand their diagnosis, the care that they need to receive, and even for the patients who maybe do speak a little bit of English but are not fluent, this will help them completely understand the medical terms and their diagnosis. So this is really vital to understanding their care. It also takes the stress off of family members that may have to interpret during the appointment. It also will cut down on errors because it is best to have somebody who is medically trained to interpret instead of a family member. This will cut down on the errors. Possibly the family member won't receive all of the information being told to them during the appointment if the family member isn't quite understanding what's being said to them as well. So these medical interpreters are very vital to the appointments. And then after the appointment, I believe it's also very important to have handouts and information for the aftercare because they need help during and after these appointments to understand the information given to them. So one thing that it could help would be with taking medications, helping them understand the dosage and when to take the medication, and this will really avoid any kind of harm or harmful effects of the medications that the patient should be avoiding if they can take it properly. Also, if a patient may have diabetes, this may help with their diet, how to control their blood sugar, what they need to do with that, which is very vital for these patients to know. And there is an article, it's called Communication Barriers in Counseling Foreign Language Patients in Public Pharmacies, that states migrants are at a greater risk for adverse events and errors in healthcare. This is due to them just not understanding the information being given to them or the facilities that they are at not being fully prepared to give them this information. Just because a patient does not speak English or is not fluent in English does not mean that they deserve lesser care. Like I said, 21% of Americans do not speak English. This is 1/5 of our population. This is due to the 2011 census and the information that they received, and this number will only begin to grow. I do believe that if healthcare for non-English speaking patients were to become better and more readily available, that healthcare for everyone will increase. So my recommendation would be to have medical interpreters, medical information, handouts for aftercare readily available for these patients who really do deserve the best care that they can get, as does everyone else. So thank you for listening. This was health literacy with non-English speaking patients. Thank you.